I think we will start with your session on apps for smart ophthalmologists. So if you are a smart ophthalmologist, you must definitely be using these apps. Smart ophthalmologists, all take notes, please.
Good morning, everyone. Presentation. It's not coming here. No, Neeta Joshi.
Sorry?
You want Devika to come?
So Dr. Devika is back. So I think we will have Dr. Devika who is going to present machine learning and artificial intelligence in ophthalmology. Over to you, Dr. Devika. Sorry for the confusion. So we are starting as per the order in the book. The order in the book is Dr. Devika Bhattacharya is starting the session. Dr. Devika Bhattacharya.
Good morning, everybody. Myself, Dr. Devika Bhattacharya, and I will be speaking about machine learning and artificial intelligence in ophthalmology. There is no financial interest. It is not moving actually. Slides are not moving. Artificial intelligence refers to the ability of the computer system to perform tasks which typically require human intelligence, such as visual perception, speech recognition, decision making, and natural language processing. AI is achieved through the use of algorithms and statistical models that allow machines to learn from data and make predictions or decisions based on that learning. In real life, we have the examples of ChatGPT, Bard, Alexa, Google Assistants, and so on. Machine learning plays a crucial role in AI, and deep learning are the ways of achieving AI in real life. There are subsets of artificial intelligence. There are 10 subsets, which are machine learning, deep learning, expert systems, fuzzy logic systems are the main arms. This is a flowchart depicting the different arms of artificial intelligence, that is machine learning, natural language processing, expert systems, speech recognition, planning, robotics, and vision. The uses of AI in ophthalmology. AI can be used in diabetic retinopathy screening, glaucoma diagnosis. AI system developed by Google uses deep learning algorithms to analyze retinal images, identify signs of the disease. It has a high degree of accuracy comparable to human ophthalmologists. Then it is used for glaucoma diagnosis. A study published in Translation Vision, Science and Technology in 2019 accurately diagnosed glaucoma based on OCT images of the optic nerve head. It uses deep learning algorithms to analyze images. It identifies features associated with glaucoma. Then we have age-related macular degeneration diagnosis. It uses conventional neuronal network to analyze images and identify signs of the disease. It diagnoses AMD using OCT images. Then it can be used in cataract surgery planning. AI study system accurately predicts post-operative refractive error of cataract surgery patients. It uses machine learning algorithms to analyze pre-operative measurements. It identifies factors that could affect outcome of surgery. Then we have machine learning system. We have different monitoring tools which are such as Optic-in, Retinal device, ProView eye pressure monitor. Then we have screening tools. It has iArt AI system. Then we have diagnostics tools, that is IDXDR. Then we have expert eye system and ProView eye pressure monitor, that is non-invasive eye pressure monitor measurement using glaucoma diagnosis. We have iArt system is FDA cleared screening tool for diabetic retinopathy. Then Retinal device is an instrument for diagnosing various retinal disorders. Coming to expert system, it uses in cataract surgery planning and glaucoma diagnosis. We have cataract coach. It uses biometric data and patient information. It determines the optimal intraocular lens power and it plans the surgery. Then for glaucoma diagnosis, we have a cloud-based solution which uses data from visual fields and OCT scans to detect the probability of glaucoma. It is named as glucositine cloud-based solution. Then we have refractive surgery and retinopathy diagnosis. For refractive surgery, we have ART scan software which is used for refractive surgery planning such as LASIK. It analyzes data from corneal topography and patient information to determine the optical surgical plan. In retinopathy diagnosis, we have retina scope. It uses data from patient information and fundus photograph test and OCT scans. It helps in diagnosis of retinopathy. Then we have fuzzy logic based system. We have OptiEyes, iQuant, fuzzy logic based cataract grading and fuzzy logic based glaucoma devices. Coming to Optimize, it is a website which stimulates the eye of different types of intraocular, stimulate the eye of different different type of intraocular lenses on visual acuity and contrast sensitivity. It helps in choosing the best lens for cataract surgery based on individual patient characteristics. Then we have iQuant. It is a web-based tool. It analyzes the visual impact of web page designs. It can help web designers optimize their designs for maximum visual impact and user engagement, it including considerations for individuals with visual impairments. Then we have coming to fuzzy logic system, that is glaucoma diagnosis. It is both an app, can be used in iOS and Android devices. It is detecting the glaucoma by analyzing a combination of clinical and imaging data, including visual field test, optic nerve head parameters, and intraocular pressure. For cataract grading, we use a fuzzy logic system to grade cataracts based on combination of clinical data, including visual acuity, glare testing, and slit lamp examination results. Then coming to deep learning system, it is a subset of machine learning that uses deep neuronal networks to learn and make predictions from data. So for that we have Eye Wellness Exam, Viz AI, Notal Vision Home OCT, DI, and Topcon Harmony. Eye Wellness Exam analyzes optical OCT data scans from the retina. It provides information about retinal thickness and diagnoses various retinal diseases like ARMD and diabetic retinopathy. For Viz AI, it is an FDA-based approved which analyzes CT scans of the brain to detect and prioritize large vessel occlusion strokes. It analyzes images in real life and can notify a stroke specialist to intervene quickly. Notal Vision Home OCT. It is home OCT that allows patient to perform OCT scans from home. It analyzes the scan and detects signs of disease progression in patient with ARMD. DI, it's a smartphone attachment that can capture high quality images of retina to analyze the image and provide a rapid assessment of retinal health. Then we have Topcon Harmony. It analyzes retinal images to detect signs of diabetic retinopathy. It uses deep learning, provides a score for the disease, and can help ophthalmologists to triage patients for further evaluation. Now coming to individual diseases, first coming to use of AI in retinal diseases. First is iNuke, IDXDR, Remedio Fundus on phone, Retinal ACE, and Retinal AI. iNuke is FDA approved. It is both CE marketed and it is still used in United States and European Union. The link is given here. It analyzes retinal images and detects signs of diabetic retinopathy with other pathologies. DX is FDA approved. It again uses retinal images for the signs of diabetic retinopathy. It is a software program that uses artificial intelligence to analyze retinal images taken from the Topcon TRC NW400. This is the IDXDR report. This for analysis of DR. Then we have Fluid Intelligence, that is Retinal AI. It is an app based. It can also be used in, and then we have Remedio Fundus on phone. Few AI websites powered AI. It is Google AI Health Care, which again detects DR by iPACS. Then we have Topcon Healthcare. Then we have Nova site. It provides vision therapy platform that can diagnose and treat amblyopia. Then we have Notal Vision. It is home-based OCT used by capturing retinal images for remote monitoring system of ARMD. Then coming to vision system, we have IQ, Peak Acuity, Colorblind, and Contrast. IQ is AI-powered app, which is it allows users to perform vision test. Then Peak Acuity test can be used in telemedicine services to remotely diagnose various retinal diseases. Then contrast can be used in patients with who has high contrast defective in contrast sensitive before planning the cataract surgery. Then we have AI tools which are available for cornea. We have Caranova, we have Corneat Pro Scanner, we have Quickic, Webex Rapid, iNetra, MIS, Topcon Harmony, and Remedio AIM. iNetra is an AI-powered app that uses a smartphone and a clip-on device to measure refractive errors, astigmatism, corneal curvature. Similarly, Caranova can be used in performing keratoplasties. Further coming to use of AI in glaucoma, we have Deep Glaucoma Net. It is OCT based, not a commercial product. It is Eye Wellness Exam, software application developed by OptiView. We have Quicker, Simpler, Safer, which uses OCT images to classify glaucoma. We have Glaucoma Finder, which is a web page based on OCT images. Then we have Art AI. Then coming to Netra AI, it's a near eye tool for refractive assessment. It evaluates the glaucoma damages by the color under photograph. It saves times and costs with faster screening, and it's a real-time virtual second companion of the click, which a click on a button. Netra had a sensitivity of 90.9% and specificity to 96.2% for detecting glaucomas. Then coming to IOL power, after myopic and hyperlopic surgery, we have Reiner IOL calculator. This is a website given down. IOL Master 700 online calculator. This Hill RBF calculator, again it is online based. Then we have Barrett Universal 2 Formula AI to estimate the effective lens position based on AI preoperative biometric data. Then we have IOL Master 700 calculate online. This is the website given. Then we have IC2 IOL, then IC2 IOL, and then we have SurgiMap, which is 3D simulators. For IOL calculations, it is AI powered. We have Orasis AI. It is a cloud-based platform. It is EuroQ. It is a web-based platform used for accurate calculations. Then we have IOL Master 700 with Swept Source OCT. Then we have calculator cataract surgery calculator. It is also machine learning algorithm based on IOL power calculation. These are the website again used for IOL power calculation. These are the this is the web page used for IOL calculation for eyes with prior myopic and LASIK PRK. You can get it in online. Then we have Hill RBF calculator version 2. Again, it is available online. So coming to conclusion, AI can be friend or a beneficial tool. It helps doctors in preventing and managing disease. Second, it's a bad effect. AI can even overpower human, de-skill a patient. So ophthalmologists should know about the AI resources available to them and make judicious use of them when understanding their limitations. Thank you.
Thank you, Dr. Devika Bhattacharya, for that amazing overview of deep learning and machine learning and artificial intelligence in the eye. There is a lot of things happening in this space. Machine learning is getting better day by day. Every few weeks you see a new AI being released. There is Google's Gemini. They are able to generate images based on prompts. And being a prompt engineer is a new job. So if we can learn how to ask the right questions to the AI, that itself is a new job which is coming up. Next, we have Dr. Mita Joshi, who has been with us since the beginning of this instruction course. So this instruction course has been running for the past 5 years in all the AIOCs. She is going to talk to us about the latest in the apps for smart ophthalmologists, iApps, Go Tech Savvy. Over to you, Dr. Mita Joshi.
Thank you, Dr. John. Good morning, everyone. Thank you for being here. And I'd like to thank AIOS for this opportunity. We all know apps are a self-designed program or a piece of software designed to fulfill a particular purpose, which can be downloaded by the user on a mobile device. Apps are now a part of our daily life, and we have apps in ophthalmology which perform a variety of functions such as medical education, practice management. We have our books and journals on apps now. We have our whole conferences on the apps now, and there are apps for patient utilizations. Apps for imaging would be dealt with by Dr. John. Medical education, you have lots of apps. One of the most important ones which I find the most useful one, handy one in our day-to-day practice is the eye handbook. It has a variety of features such as testing of the patient. You have the Amsler grid, the color vision chart, contrast sensitivity, duochrome test. There is a fluorescent light also, so you can examine any bedside patient for an ulcer or something just by simply staining and using the screen as a fluorescent light. And there are near vision charts also. Contrast sensitivity, like I said, you can just test easily in a handy manner. Worth 4 dot test for the diplopia patients you can have for distance as well as near. Distance we usually have in our charts. For the near, you can use this your own phone as a device. Color vision, we all have the little black book in our OPD, but for over a period of time the plates tend to fade out. So you can use the app as a device for checking out color vision. Pediatric cases, you can have pediatric optotypes and fixation targets so that the kids also enjoy looking at a device and you can simultaneously check their vision. There are settings given, so you can have your laser settings at your fingertips and you can just recheck them before performing a procedure. Calculators, which Devika also mentioned, are given within the app also, so you can just use them for your day-to-day practice. There are diagrams given which you can use to explain to the patient certain diseases. Vision symptoms are described so that the patient can easily understand what's going on. The another app is ophthalmology, which gives you a short précis of the diseases, so you can just have a ready reckoner at your hand. Draw MD allows you to take pics and draw onto the template itself, and then you can share these with your patient via email or print. iTube is the YouTube. You can have a lot of surgeries on this. Just go through them quickly so that before going into your OR, you have a quick revision of the procedure which you are going to perform. Glaucoma risk calculator is based on the OHTS studies. You can enter in the data and it will give you the risk assessment and just an outline of the treatment which you can plan. This is one of the few tests which everybody struggles to do, and this you can have an app online and just use it so that it is easy to perform in your OPD. TLA, there are a lot of short forms in ophthalmology and TLA helps you with that. Just put it into the app and you'll have the full form of the required. EmbryoCare allows you to give home exercise to your patient so that with your patching you can have exercises also. Snellen charts are also available now onto the phone, so you can just download them and have a quick check. The toric IOLs are progressing and you can have toric markers as well as calculators which you can have on your phone. Practice management apps used are Dropbox, so you can share your documents. You have scanners, so you can just convert the OPD paper into a PDF and share it. OCT browsers are available, CAM cards are available, which you will just screen and convert a piece of paper into a digital data. Epocrates and Skyscape help you with your medication. Epocrates, you can just have a quick look at whatever medicine you are planning to use. Apps for medical journals are also now there. We have our own IJO on the app. Apps related to conferences, we have all the data of our conference on the app, so you can see which sessions are going on and plan accordingly. These are the apps which you can advise your patient to download on his or her phone. And since we have elderly patients, these are very useful apps so that they can monitor themselves. You have low visual aids, we'll be coming to them shortly. The site book also helps you. It has a built-in AMSLR, so you can just ask the patient to do a weekly check and get back to you if there are any changes. So this you can just it gives you simple directions also so the patient can follow and then report back to you if there is any abnormality. This is a test for contrast sensitivity. The size and the contrast keeps on changing, progressing, and the patient can just keep a track at which level he was previously and then which level he is now and come back to you if there is any problem. Eye drops, this is a very important app, especially elderly patients who are living alone. So this you can ask them to download, put in, just feed in the data, feed in the timing of the drops which has to be put, and the patient can then easily put the drops without forgetting. Be My Eyes, this is available outside, not in India at present I think, but this allows patients with low vision to just go around, and if they'll send out a help signal and there will be someone online who will be willing to help them out. For your young patients, you can have fancy contact lenses which you can ask them to just check in on a picture without putting the lens and then select the type of lens they want to wear. Now this is one of the things which I just recently learned. I have a cousin who's losing vision due to diabetic retinopathy, and his day-to-day working, his office, how he's managing, this I've just managed to learn now and I'm imparting it so that you can give it to your patients also. There are certain web content accessibility guidelines, how your website should work and what all features should you have so that persons with disability can learn them. So you have screen reader software, speech recognition software, special keyboards are available, and you have screen magnification software. These are especially useful for the ARMD and macular degeneration patients. So this feature is available on the phone, the narrator. What it does is, it describes your surrounding. And all the instructions are given verbally so that the person can listen to what is going on rather than just read.
Not show me again.
OK, button. Lookout explore mode. Help, button. Shelf. Double tap to activate. Backpack.
So in case you are going to a new place, it will just on.
Ring.
This is a reader, so just
Mode, 3 of 6. Text. Selected. Double tap to select. Lookout text mode.
Retinal Diseases, 3rd edition, JSPAHWA, OP, BILLORE.
so you can read. And the Kindle is also available in an audio mode, so the books also can be read. And you can design your own app, you have your own hospital featured in it. So patients can know about the team which you have. You can have fixed appointments through this app, give feedback and stay in touch. There are certain issues with apps like patient privacy, what kind of data which you will be sharing. Cell phones are notorious germ carriers, so you have to be very careful when you introduce them into your OR. Sharing over social media, again you have private confidentiality issues. And then you have the authenticity of the app, the data which the app is giving you, how genuine is it? And FDA approval of apps is not far away. Thank you so much.
Thank you so much, Dr. Mita Joshi, for that overview of the smartphone apps for the smart ophthalmologist. So all of you who want to be the smart ophthalmologist, make sure that you have these apps with you. There are so many apps, but you need to know which ones to use, which ones the smart ophthalmologist will use. So I think she would tell us one app which every ophthalmologist should have. Which one would you suggest, madam? So she says the Eye Handbook app. So that is one app which is a comprehensive app which all of you should have.
So next we have Dr. John Davis Akkara. He'll be speaking on smartphone eye imaging, anterior, posterior, gonio, topo, 3D, and even smartphone measurements for ophthalmology. Over to you, Dr. John.
So good morning, everyone. As usual, Sunday morning is a little difficult time for us. So we will be talking about smartphone eye imaging. So this includes anterior segment, posterior segment, gonioscopy, also the corneal topography, the 3D smartphone imaging, as well as measuring. So these are my financial disclosures. Now, no particular financial interest in this presentation, but I have made several apps which are available. And I have a virtual reality headset, and I have plans to make some commercial apps in the future. So right now what is mentioned here, these I have no financial interest in particular. So why click photographs? So you need photographs for documentation, for expert opinion, for teleophthalmology. You needed to monitor progression, regression of lesions such as corneal ulcers, abrasions, SPKs, pterygium nevi, hemorrhages, and so on. And it gives the patients a better understanding of the disease. It is easier to counsel the patients if you show them exactly what you see. For example, a foreign body on the cornea, the abrasions, any ulcers, any retinal lesions. And you can also use software to measure these lesions. It is not very difficult. I'll show you how you can use a software on the phone, an app to measure these things. And why smartphone imaging? Because the best camera is the one that is always with you. It doesn't matter if you have a very expensive top of the line camera which is sitting in a particular room somewhere, if you cannot use it all the time, if you have something which is there with you, which is accessible, portable, allows you to quickly review the photographs, edit the photographs, share the photographs, do online backup, all the while it's being affordable. There is nothing like it. Doesn't matter if you have the most expensive camera in the world, it matters that you have it with you. And for glaucoma, you can take photographs of gonioscopy. These photographs on the sides are done with smartphone. I think this is with the OnePlus 3T. That is many generations back, not the new phone, okay? And you can take optic disc photographs, retinal nerve fiber layers. You can put it in the red-free illumination. You can take slit images of the Van Herrick's grading. You can take teaching videos of whatever procedure you want to do. So all these things can be taken on your phone. And you can check progression. So you take disc photographs, you can check progression. You have any hemorrhages, disc hemorrhage, you can check the progression. And you can tell the patient, see, this is what disease you have. Give them a photograph immediately on their phone. The doctor-patient rapport is so much better when you have that understanding. And of course, you can, it's very important in disc suspects. So I always give a photographs of the disc to the disc suspects and tell them, see, keep this safely with you. Put your name on it, put it in your email, so that next time I see you, you should show this to me. I always have a backup, but when you give them that responsibility, they take care of their health. In the cornea, you can take diffuse illumination photograph, slit photographs. So slit photographs are a little more difficult. I'll tell you how to take them. You can do photographs of pigments and KPs on endothelium. You can do retro illumination. You can do fluorescein staining. For that, you have to again adjust the brightness and focus. You can take videos of tear breakup time. You can even do clinical specular imaging. Okay, mind you, this is on a phone. On a phone with a slit lamp, good slit lamp, you can take specular imaging, endothelial cells. And there are several adapters available, so many available. This is the one which I commonly use because it is universal and affordable. It's like 400 rupees or something. You can get it on Amazon. There are some which we had 3D printed. This is that same 400 rupees adapter which we were using in Arvindai Hospital, Pondicherry, recording a surgery through the side observer scope. So these things are easily doable. If you don't have a camera, doesn't matter, you can still use your phone. And these are some videos which show you how to use it. Quickly go through it. First, open the camera. The regular camera app will do. Yeah. And bring the phone to the eyepiece of the slit lamp. So mind you, there should be a space. You have to keep it near the eyepiece. I usually keep it horizontal like this for stability. I just keep the phone in my left hand. Just hook my hand onto the eyepiece. Make sure that the circle is sharp. So when you adjust the phone forward, backward, you get to a point when the circle is sharp. The point where the circle is sharp is the best field of view, best focal point. So you keep that. There is always a space of 2 to 3 centimeters here. I use my fingers, the 4th, 5th fingers to stabilize, ring finger, little finger to stabilize, and I hold the phone with my thumb and index finger, and this is how it works. If you get it right, you can just get pictures very quickly, very rapidly. You can also use the adapter if you want to take videos. I use the adapter if you want to take videos of the retinal examination, so 90D, 78D, and also gonioscopy. But for everything else, I just use my hand. Very quick, very, very quick. If your eyepiece cap can be adjusted forward very well, you can use that as an advantage to give this extra space of 2 centimeters. Once that is done, you can do the same thing as I showed you. You get a clear circle, sharp circle, and for slit, you need to do touch to focus. You make a slit and you long press, and this is fundus, of course. This is 78D, yeah, 78D, undilated, mind you, undilated 78D. You can do this and you can take photos. So here in this, you cannot see it very clearly, but the recorded video was pretty good. If you can do 90D examination, you can take photos with that. And apps, you can use a regular camera. Regular camera app is pretty good, but it would be very useful to have an app for that. So there are some apps like this. There are also apps which let you store the patient details, which we are also updating an app like that very soon. Then settings, flash off, HDR off, AI off, beautification off, portrait mode off. All the extra fittings you turn it off. You just need the camera in the basic mode. Touch to focus, not touch to click. Metering on touch, that is, it has to adjust the brightness according to the touch. And then you can zoom in to remove all the outside black circle of the slit lamp. It is not required. You zoom in to your point of interest, and you can adjust the slit lamp light for it to be comfortable. Room light, if you can turn it off, well and good. That removes some of the glare and extra artifacts which come up. Exposure, you reduce it to the lowest, which gives you a better image. If you look here, I made a slit to show this vitreous. It's a little difficult to see otherwise, so made a slit, and this is vitreous over here in the anterior chamber. Focus, you long press and then adjust the focus. Adjust the brightness also up and down. You can lock the focus by long press. That is the long press thing. White balance, usually automatic works fine. If it does not, if it's white light, you adjust to incandescent. Yellow light, you adjust to halogen. ISO low if for most photos, but if it's very low light, you can adjust it a little high, but you get more grains. So quality reduces, but you get better pictures, better brighter pictures. Shutter speed is faster is better. So you try to get the best of these, adjusting all these. So slit, long press, adjust the brightness up and down. Long press on the point of focus. So you long press exactly here, okay, and then up and down. So that is some Morgagnian sunken nucleus that was there. Pseudo exfoliation at the angle. Again, this is overexposed, so brightness should have been reduced. Here you see a focal decimate detachment at the place where a laser injury happened. PI was being done, there was a laser injury. So that is another thing which is here. And always you may not get entire picture as good, so you might have to edit. So this particular picture, it was cropped to remove all this unnecessary glare. So this is the point of interest. Remove the points which are not of interest. And corneal dystrophies, it's focused on the cornea here, not the iris. So make sure you adjust the focus. So you are playing with light and focus. Make sure you play both properly. Then there can be decimate tears. You make sure that you focus and adjust the light so that the glare does not obscure your point of interest. Then angle of illumination, you can adjust the angle to see things which are behind. See the same eye. Here you cannot see anything behind. By adjusting the light, you can see the fish tail of the posterior polar cataract going into the vitreous. Then you have a traumatic cataract here. You have anterior subluxated lens here. Specular photos can be done with the same technique which you use for specular photography, and you have to focus on the inner illumination. Okay, so here you have to focus on this part, adjust the brightness, adjust the focus, and then you can get pictures like this. And gonioscopy, I don't need to add anything extra. You just have to make sure that you put it on the adapter so that you don't worry about one hand holding the lens, one hand holding the joystick. Do you have a third hand or not? Fundus photographs, you can use different methods. This is with 78D, 90D. You can take fundus videography like this. You can even take images of a vase ring. You see the vase ring here in the shadows. I'll just get back to it. See this? So this is all a play of light and shadows. You adjust the light, adjust the focus. You can take photographs of any of these things. Then of course there is the do-it-yourself red cam, foldable fundascope, Jais red cam, made in India red cam. All these can be used to take fundus photographs by indirect ophthalmoscopy method. So there are several options available, and videos in sitting and standing position. So the here, whereas in the sitting position it was not very much visible, right? So these are the other methods for funders. We saw these pictures already. These are the videos. You can see the sparkling material in this phacolytic glaucoma and the post-op eye, some uveitis is there. You can see the flow of pigments. 3D, I don't have much time anyway, but I'll just tell you that you can take 3D pictures which can be viewed in the headset. You just look up this particular app, 3D Atlas of Ophthalmology, in the Play Store. You can use that. These are all 3D pictures taken with this app, and you can read more about it there. And images you can measure by using, measure by using this particular app. So if we have time at the end, we will discuss all this in the discussion part. So this is another project of mine where we do measurements by using smartphone apps. So thank you. Next we have Dr. Prithvi Chandrakant, who would be talking to us about the magic of 3D printing in ophthalmology. So 3D printing is one of the technologies of the fourth industrial revolution, which is very, very useful for an innovator. And if you learn 3D designing, 3D printing, you can make anything that you can imagine in your mind. So over to you, Dr. Prithvi Chandrakant.
Thank you, Dr. John, and thank you all India for giving me this opportunity. I'll be talking about 3D printing in ophthalmology. There are financial interest Dr. John has in few of these 3D printed materials. So what is 3D printing? It is printing a physical object using a printer. That is what it is basically. So it consists of designing. You use a CAD software and design one product, and then you transfer it to the printer. So it will slice it and then start printing it. So before that, a post-processing is done, and then you get a final product. So this is what is a whole process of 3D printing. So this product is actually a proper, so it can be done with using a polylactic acid or a ABS material. Polylactic acid is much more easier because you can prototype and it is a little brittle. But then if you want a more better version, you can use the ABS ceramic or even titanium and stainless steel material. So what are the methods? One is extrusion, by which the filament comes out of the 3D printer and it makes up the product. But then there is something called a sintering, where a laser comes in and melts the steel or metal and makes a product out of it. So these are all the materials which can be used for making a product. SLA is one of the most easiest thing, and for bioprinting we use inkjet. So where do we actually able to design? So there is something called an online designing platform, that is Tinkercad. So over here what you can do is you can just go in online, log into your account, and then you can start designing your own 3D printing device. It is basically, using cylinders, cube and all those things, put it together and design your own 3D model. The only thing is you need to be very sure about the measurements. And this is something which all children even are doing now. So it is so easy that even children are doing. So you can do it by yourself if you can go into the Tinkercad, and it's a basic thing. If you want a more modified, more advanced thing, you can even buy the software. And then if you want free 3D printable objects, you can go to Thingiverse. So in this website, you can actually browse for things which are which you can download for free of cost, and you can send it to a vendor who can 3D print for you. So each of all the cities actually have at least one 3D printer, or even if you don't have, you can get it, parceled it from any other city also. It's so easy. So 3D printing in ophthalmology is being done in various specialties, and there is a few articles written by Dr. John on this subject, which you can go through. So the first thing which we would see is 3D printing adapters for surgical instruments. So surgical recording. So this can be used for recording videos in our OT. And then one of the most red cams are the most ones made in 3D printer. The first ones and the most 3D printed material were the red cams. Over here you can see the ODOC fundus camera. So these are all the other different Indian 3D printable cameras which are available. This is a foldable 3D printed John Dash foldable fundus camera, which Dr. John has patented now actually. So it will be in the market soon. So here you can see the demonstration of how it is foldable, and it is very easy to keep it in your pocket itself. So you can just take it around in your pocket, you can just open it and start taking fundus images on the spot. This is a 3D printed slit lamp, so you can have a slit along with a magnifying lens which will help you convert your phone into a slit lamp. There is even a peak retina which is 3D printed for taking images of the disc. There are 3D printable models which can be used for surgical wet labs like Cordelia, and these are all. This is one of the 3D printable model done by Dr. Prashant, and this is used for phacoemulsification. And there are 3D printed materials for orbit dissection, where you can actually practice your orbit surgeries. It can be used for your fellow training. And there are 3D printable models about for radio surgery, where you can actually print the case, and then you can see what is the least radioactive place where you can give the treatment. There are 3D printable OCTs where the retina has been OCT retina has been converted into 3D models for use of to counsel the patients more easily. There are 3D printable designing for instruments, even trocar cannula which can be designed. We have done something exactly. The first thing was to there are even reconstructive surgeries where you can use these material for orbit blowout fractures. There are implants which have been 3D printed nowadays, and it all can be modified according to the case. So if you have a case, you can just see how much measurement you want, and you can actually 3D print exactly the measurement which you want. There are 3D printed prosthetic eyes which are available now, initially started in South Korea. And recently we have seen a growth in spectacle. So the spectacle market has started 3D printing spectacles even. And one more thing is, it is very easy if you have any kind of facial problems, you can actually measure and 3D print a spectacle exactly to the measurement of the face. You can see a article written on the same thing. So there are a lot of other things which we can do, but because of want of time, we'll go through the 3D printed things which we have done in our setups. There are even 3D printed cornea and retina which we have just started. This is a 3D printed eyedropper helper which we have done in Arvind Eye Hospital. And this is also a dry lab 3D printed eyeball where you can use it for indirect ophthalmoscopy. You can use it for indentation. You can see how the material can be used for indentation over here. Also, it can be used for teaching lasers to the trainees. You can see over here how we can train new residents and optical technicians. Over here we have a 3D printed simulator for the patients where you can show them the light and explain to them how it will look during surgery so that they will cooperate more. And there is a eyedropper which is incorporated to the glass frame. So this is a glass dropper, and we have an eye opener which can be which we can use to cotton buds, and actually it will help you open the eye during foreign body removal, etc. There is a 3D printed 90 holder. During the COVID, it was very important for us not to have cross infections. Over here, there are a few 3D models, a surgical instrument which Dr. John has made, which is available in Thingiverse for free. So you can actually download these 3D printable models and use it for your training as well. Going to a few of the things which I have made. There's something called a slit scope which we made. The 3D adapter is actually used to convert the the torchlight into a slit light. So with this, what you can do is you can start taking images of the eye without a slit lamp. So you don't really require a slit lamp. You just put the adapter to the torch and then take images. Then we have the gimbal scope, where a small attachment, the 3D printed attachment, is put to the retinoscopy device, and then the camera which comes out of it will start recording the reflexes, which makes it very easy for you to actually teach your residents on how the reflexes look, with against the null point, the scissor reflex. You can see a small demo of the reflexes, and this was one of the first device which actually is able to record the retinoscopy reflexes, which was not done before. You can see against the movement over here. Then we go to the Retilite, especially for the retina surgeons who are more dependent on the illumination. What if something happens, like the illumination goes off during surgery, and then you don't have anything else to carry the surgery forward? So we came with a small innovation where we make the device using 3D printed PLA. At one end, the optic fiber head goes, and the other end is connected to the LED. So this is a mix and match of different adapters we can do over here. So over here you can see the LED is in one part, and this part is for the illumination head. So once you put this over here, so this fits snugly over there, and then you can even on the LED over here, and once you connect it, you can actually see the illumination in the other part. Going to one more problem which vitreoretinal surgeons face is they don't know where the port is, because the room is dark. It is very difficult for them to actually find the port to put the instrument inside. So we devised something called the glow port. This is a 2mm ring kind of a structure which is made up of glowing material. So what happens is, with this, you can see how beautifully those glow ports glow in the dark, and it makes it very simple for the retinal surgeon to actually put the instrument into the eye without onning or offing the light. So you can all start printing your own thing and designing your own in Thinkercad. Thank you.
Thank you, Dr. Prithvi, for that amazing introduction to 3D printing, the magic of 3D printing. So all of you here, be inspired, start learning how to do 3D designing. It's very simple. Learn it online from the University of YouTube. And once you do that, you can start turning your dreams into reality. Practically, you can do that. And next we have Dr. Akshay Nair, who is going to talk to us about the 3D surgical simulators, virtually perfect training for the beginners.
All right. So I'll be talking about 3D surgical simulators, virtually perfect training for beginners. These are my financial interests. I am associated with Help Me See, which is a company that is in the domain of simulation-based training. So this is a brief overview of what I'll talk about, the different types of simulation available in the ophthalmic sphere for training, the types of simulators, the way we can assess whether simulators work or not, and finally, what evidence do we have. So there are simulators available based on the type of skill that is intended to be taught. It could either be a clinical skill in the clinical room, in the examination room, like gonioscopy, indirect ophthalmoscopy. It could be a surgical skill like cataract, vitrectomy, or other surgeries. So there is different types of simulators. There are model eyes with microanatomy of the eye built in, which gives you the same kind of image like a retina fundus when you see with the 20D, that is the retia. You have the simuli, which also works as a good target for lasers. You also have the IC indirect ophthalmoscope, which is a head with different types of pathologies that you can see, as well as different types of pupil sizes that can train you in how to use an indirect ophthalmoscope well. So similarly, on the types of simulators that you can have animal models, you can have human cadaver models. See, at the end of the day, every simulator is not a high-tech piece of gadgetry. Any task, object, or process that mimics or simulates the actual surgery or the procedure is a simulator, which is why using even a cellophane tape or an IOL box to practice capsulorhexis is a type of simulation. And all of those would come under the inanimate objects that we have. And finally, we come to virtual reality, which I'll speak about in depth. So we typically hear the word wet lab and dry lab, etc. The reason why we use the word wet lab is because they use chemicals or tissues that can be wet hazards. So typically what we use is human eyes or animal eyes. This is this paper by Bharti et al. Where what they did was microwave a goat's eye for 30 seconds, the heat induces a cataract, and then they go in and try and practice cataract surgery on that. You can use vegetables, fruits, or bits of both tissues like tomato peels, etc. Inanimate or artificial models such as this, which is the Kitaro eye, are very popular. You can create an artificial anterior chamber where you inject it with viscoelastic, and this has a very good visual feel as well as a tactile feedback to do a task like capsulorhexis. But as you can see, the moment you've done one capsulorhexis, that entire lens model is now not usable. So a high requirement of inventory of these eyes is needed, especially for trainees who are prone to making errors. So if only there was a way where you could have an unlimited supply of eyes or training material, and that's where something like a simulator, a virtual reality comes in. This is Vitret Eye, which is a Philips-based model for vitrectomy. And of course, dry lab training where there is no spillage involved, like I mentioned, an IOL box or a Rexus forceps on a taut aluminum foil, all of them work as well to train some amount of skills needed in the real OR. But how do you know whether it works or not? So you really need to assess the performance on a simulator to know whether it actually correlates to real life surgery. So there are two ways of doing this, cognitive skill and technical skill. Without going too much into detail, there are different rubrics and models that are already created that can help understand whether a trainee who is operating on a simulator is doing it the right way, which is called the SIM-OSCAR. And there are different papers that have been published that have shown whether it works or not. Now, when we come to virtual reality simulators, these simulators themselves have a inbuilt scoring and assessment. This is the scoring system of the IC simulator, where unless you reach the level 1 and do a task well enough, you don't go to the next level. Now, this is the inbuilt scoring and assessment of the Help Me See simulator. So here you can see that the trainee is performing a task, and the number of errors that he's doing, say for example zonular damage, all of these are being calculated, and the inbuilt system itself will tell you whether it was a satisfactory attempt or not and grade you. So you don't even need an instructor to be there. And the advantage of a virtual reality simulator is that there's no worry of collateral damage. You can do a capsule or posterior capsule rent 100 times without worrying what is going to be the effect on the patient, because you're not doing it on a patient. You can learn, relearn, unlearn, and do that everything again and over again. You may have done 200 cataract surgeries, but you may not have had a rent. And that first rent that you have, you don't know how to react. But if you've prepared by doing it over and over again on a simulator, then you're much better prepared when it happens in real life surgery. So the Help Me See surgery simulator is available for SICS, for phacoemulsification, for complicated scenarios like putting in a CTR, anterior vitrectomy, and for scleral suturing. How does it work? It has it is designed to resemble a patient, and you've got haptics or handpieces through which, and what you see through the microscope is the eye that you see on top, and you can see the surgeon here wiggling his hands, which is basically the crescent going through the scleral tunnel. It has a 3D visual that you see, and this is the assessment. I think we already went over this. Similarly, for phacoemulsification, this is trenching happening, and it has a foot pedal. So you also learn hand, eye, and foot coordination. You need to know exactly on which mode is irrigation, how do you go into aspiration, how do you change the power settings. And there is always an instructor who sits by you doing training, helping you train. You can see that these are hyper-realistic visuals. They are 3D visuals. It gives you real-time feedback, which means you get the actual sensation of touching an eye, the virtual eye there. And it's got an AI-based scoring and one-on-one learning with feedback. And the Help Me See simulator is now available for training in India. There are multiple installations, including LV Prasad and Arvind Eye Hospital, Madurai, where external trainees can come in, learn on the simulator and go back. But does simulation-based training really work? Here I am talking about simulator, but does it work? There are actually many studies that have shown that ophthalmic surgical simulator training improves the performance of capsular access. So in this study, they had a group of trainees perform capsular access. They had a 15% complication rate. They learned simulation capsular access on the simulator, and their complication rate went down by 50%. Again, this is a paper that showed that assessed the complication rate of surgeries done by trainees who've trained on the simulator versus those who've not trained on the simulator, and there was a 50% reduction in posterior capsular rent rates if you've trained on the simulator. Again, this was a paper that we had published about how if your performance in real life correlates with the performance on the simulator, which means that the simulator mimics the actual human eye while you're performing on it. The same thing, efficacy of the IC simulator in training improves high tension capsular access performance, and this was also published in the Nature group. I was the co-author of this, which is this was a study that we conducted in India with LV Prasad, Shankar Netralaya and Mahatma Hospital, where we had a group of trainees who came to Mumbai, underwent simulation-based training, went back to their surgery, to a parent institute, and their first 20 surgeries were recorded. Similarly, there was another group of trainees who did not learn on the simulator and did live surgeries, and their first 20 surgeries were also recorded. The first 20 surgeries of surgeons in both groups were masked and seen by observers who did not know which video was seen by or was performed by whom, and they did an analysis. They saw that these are each of the errors that you see now. The control group is the group. The orange bar is the errors by trainees who've not learned surgery on the simulator, and the blue is the errors by trainees who've learned surgery on the simulator. Every single error was quantitatively lower than by the simulation group than the non-simulation group. Major errors, minor errors, and errors overall, you can see that they are significantly lower in the simulation group. The learning curve is much more steeper in the non-simulation group. So overall, at the end of the day, when there are better surgeons being prepared by training them on the simulator, it is going to translate to better patient safety, because at the heart of whatever we do is patient safety. So to summarize, we have different assessment tools to know how trainees are performing on a simulator and to see if the skill that they learn on the simulator translates to real life. Simulators allow trainees to be in a stress-free environment. Complications are no longer the trigger of stress that they used to be. There is no collateral damage to patients. Patients don't undergo trauma that a trainee operating them would normally cause if they've learned on the simulator. There are clear long-term benefits, and the advantage of simulator is you can have customizable scenarios, and at the end of the day, like I mentioned, we are all focused on improving patient outcomes, and that is the direction that we're going. Thank you for your time. And if you all are interested in the trade area Hall B, the Help Me See simulator is on display for you all to take a demo of it and see how it goes. Thank you so much.
Thank you so much, Dr. Akshay Nair. So Help Me See simulator is going to help you operate and help you give sight to the others, so help others see. That's what it's going to be. And next we have Dr. Prasanna Venkatesh Ramesh, who is going to tell us about his virtual reality ophthalmic ocular metaverse, or VROOM, and the headset which will show you all these, the metaverse is right here. So if somebody wants to see the headset, they can do that also. I'll be down on the floor with the headset.
Yeah, Dr. Pavitra, can you just come here? I have with me Dr. Pavitra, who has the headset with her. So as I'm doing the demonstration, she'll also be coming to you, and we'll try to have a demonstration at your place as well. So I am Dr. Prasanna Venkatesh, and thank you, John sir, for giving me this opportunity to talk on the innovations that I have done. And this is a wonderful IC to be a part of. And yeah, can I have my slides? Okay, you connect in yours. Connected? Okay, thank you. So, virtual reality and augmented reality. So these were some of the things that were least explored in ophthalmology, and we wanted to really see how far we can go with it. Yes, can I have my slides? Yes, so I am Dr. Prasanna Venkatesh, and let me welcome you into the world of metaverse. So once these things were thought as only science fiction, right? It was not really thought as really as a reality, it was science fiction. So why can we make, or how can we make something as a fiction a science-based reality? And Dr. John and Dr. Pavitra will be also coming to you and showing these ophthalmic innovations of metaverse, which is a patent protected innovation of ours, which I'll be speaking simultaneously as they come to you and demonstrate it. So I started my journey, and these are the 6 templates that I'm going to take you through. The phase 1 was always animations. So I wanted to really make animations to show how I can differentiate a simple iris process from a peripheral anterior synechia, because I was a glaucomatologist and I was finding it difficult to differentiate simple anatomical structures. So what is a peripheral anterior synechia? At different levels it can be, or what is an iris process? And then take my students or neophytes into, this is how an iris process is. You can see the fine arborizing strands. It does not cause any issue with the intraocular pressure, or it does not cause any issue in the structures visualizing behind it. Whereas in a PAS, you can always have an IOP issue, or you can also have the difficulty in the structures seen behind it. So these were simple videos which I used to train my neophytes, or rather, I used to talk to myself on a cognitive 3-dimensional imagination. And then I thought, why not we make an atlas on a pupillary block? Because that is why we end up doing the PI, right? So everything was actually an imaginative learning. And we went into YouTube and I saw what are the things that are not there. So why do I do a YAG PI? If somebody asks me, can I give it in 10 seconds? So this is what is the cause, and that is why the effect happens here, and we open it by opening it up here. And this search of thirst to create a cognitive pedagogical medium was always there. And a simple glaucoma, so some of my patients explain to me, so can you explain to me what is glaucoma in a single minute? So these were some of the things that I started making on my own data. A fundus photograph you can see, it's a 1-minute video. I zoom in, I show them the vertical cupping, I show them the bionetting sign, I further zoom in and show them the basic sciences of ISNT rule, how it is breached in a glaucomatous patient. And that is why you have this RNFL defect here. And why I need to do a visual field for you is because I want to do a structure function correlation, and then I place the OCT and reduce the transparency of the patient's data and tell them, see, that is why I want to do an OCT. So I am ordering these investigations because I want to know more about your pathological condition so that it will help me understanding better. And this is a 1-minute video. So it started with cognitive video-based learning for me, my metaverse journey, and these are some of my publications in the Indian Journal of Ophthalmology in February and June, a video-based one in IGO videos. So the thirst was always there to push ourselves more. Like, what is the difference between an ALT and an SLT? So most of my videos are restricted to glaucoma, but let me see how I can do justice to the other fields as well, as we are now collaborating with further like-minded peoples. The spot size, how it is different. What is argon laser peripheral iridoplasty? You end up reading a lot about it, but then these are the normal angles, these are the oppositional angles, and these are the laser that you do to open the oppositional angle, you can see. So this is a side angle view. Can I have a front angle view to show how it really opens up from a front angle view? So you can see the 360 degrees and 24 spots being placed, and then a gonioscopic view, because always we kept pushing ourselves into different views, where in a gonioscopy, how does the root of iris gets pulled from the oppositional angle that it is actually having. So this led to a lot of videos, and this is my channel there, and it goes under my name, Prasanna Venkatesh Ramesh itself, which you can go and see all these videos that we have created, a video-based atlas. So that kept pushing ourselves further and further into basic sciences. What happens when we remove a lens? So all these video-based animations are done by us. The fall of the ciliary body, the fall of the scleral spur. So we started making a lot of 2D, 3D models, and this was a 10-year journey, the break of a PAS that happens post cataract surgery. And then we started creating these models into different plane of choices, like the ciliary, the cavernous sinus, the circle of Willis, the eyeball model. So now we were starting to develop the holograms in 3 dimensions, and we were looking at a medium as to how we can evolve from animations to unanimations. And we started by giving an app to the users, like they can actually click a button and they can go into the frame of choice that they want to see. If they want to go into the posterior segment, they choose what they want to see. Why not? I being the user, I don't control what the observer wants. I give them the option, and they were going into it, and they were choosing their frame of choice as to what they want to see. And we started collecting the models. You can see different pathological models of various pathological conditions: retina, glaucoma, myelinated nerve fibers, splinter hemorrhages, neovascularization. And we launched it in the Windows as well, and we published it in the Indian Journal of Ophthalmology Innovation section in 2022. So that led to the creation of the augmented reality models, where you can see that we were able to crack augmented reality in the year 2021, and this was the first real-time confocal images with the fundus and the angle holograms that was created in ophthalmology, where the right-hand side you can see the video that is synced with the video that he is showing in his smartphone. So on day 1 in med school, a person can actually be oriented to what he can actually see that a retina surgeon is seeing or a glaucoma surgeon is seeing, because angle surgery is something that is really on the boom, and we focused extensively on angles and fundus photographs. Not only the fundus photographs in color, but autofluorescence, infrared and whatnot. You can see that was the unique feature of our models. We use real confocal true color images, and you can see that angle structures. This is a phone recording of the same application, IMG-AR, that we innovated, and we started collecting the same models, NTG patient with a splinter hemorrhage, retinal nerve fiber layer defect with a wedge-shaped defect that you can see here, that the same patient's data was getting pulled up, and we went ahead, evaluated this and published it in the European Journal of Ophthalmology, and we validated it. Then we wanted to push ourselves further into the headsets that you can see Dr. John there very curiously trying to demonstrate along with Dr. Pavitra. So can I catch these models in a very portable way without any hi-fi technology at this particular place where he's trying all sorts of things? You can see it from outside, it appears as if it is totally foolish and the person is insane, where you can see Dr. Pavitra there trying to catch butterflies with the headsets. But this is what happens, right? See my friend on the right, you may see him on another day and think him is insane, but he's actually demonstrating these holograms of the eye in a 3-dimensional plane, the angle structures, the fundus in color, autofluorescence and infrared. The same models that you saw, you can see that he's demonstrating the retinal nerve fiber layer defect, he's demonstrating the RNFL defect, the wedge-shaped defect, and this is pushing ourselves into other OCT filters and whatnot, because with more filters, you can actually differentiate an hydrodissection from a delineation and improve your surgical skills along with multimodal retinal imaging. And very important is the neuro-ophthalmological models that we created. We sat and read the anatomy and created the whole 3D models so that learning and cognitive mugging up is avoided, and you can actually see the neurological models for the way they are, and it is going to be there, and we published this in the August issue 2022 in the innovation section of IJO. I think this is the future, my dear friends. My daughter, she's very fond of this. Whenever I go home, she takes it for her own. She has created her own butterflies in her metaverse. I think this is going to be the future where we are going to have this in everyone's home, and we are trying to push ourselves even further where we can incorporate OCT into the fundus so that you can actually extrapolate OCT slices from the fundus, and you can actually before treatment, after treatment, a striate keratopathy for that matter, or anything. I think in the future EMR is going to be 10 years or 15 years from now. I think the patient is going to come and we will have all the data of the patient, a Christmas tree cataract or any cataract for that matter, will be completely dissected in the 3-dimensional plane, and we will be making our phaco parameters, the dissection plane of hydrodissection or hydrodelineation in a posterior polar cataract, and we are trying our level best to bring it into Android, Apple, Windows, Microsoft and whatnot. So recently we innovated the first mix simulator in 4D, where on the right hand side you can see this is all synced. The left hand side you can see what he'll be seeing through his eyes, and this is the first MAGS simulator that was made to make sure that any mixed surgeon, it will help them evolve quicker, so that you can see he goes to his wet lab, Every time the stent is placed correctly, it turns into green. You train yourself 30 times, 40 times, 50 times, and then you are ready to go ahead and you place the stent. So we have created puzzles also, we have printed puzzles, that is also part of our metaverse, and we have published it. We have created subtractive learning where you can choose and you can subtract structures, so that we want to give the audience the complete freedom of choice and have a simulator in a smartphone where even the fundus simulation with your smartphone, you move forward, you move back and whatnot. So this is a very promising field, my dear friend. We call it the 4D ophthalmic metaverse, and this is my team. I have my own startup called the Mahatma Center of Moving Images Private Limited at Trichy, and we are trying to push ourselves, keep pushing, and we publish our work, we innovate our work. You can take a screenshot of this. This is where you can find us, you can catch us here, and we keep doing all crazy things, and we have won, these are the awards that we have won in different conferences for all our images and all our innovations. I thank John sir and the whole team for giving us this opportunity and to showcase all our publications and innovations in the metaverse that we have made. And once again, thank you for this wonderful team. It's an honor to share the dais with such a wonderful team. Thank you once again for the opportunity.
Thank you one and all for this. Thank you, Dr. Prasanna, for this metaverse. So he actually came to Kochi last week for our glaucoma metaverse. So the glaucoverse for our glaucoma week program. So thank you, Dr. Prasanna. And in VRSI, you're going to see the retinoverse, right?
The love is always for glaucoma, so you can see me green.
So you won't see him. You will see his better half, Dr. Anu, coming for the retinoverse in VRSI as well. And I don't know, what is cataract verse? Phacoverse? Yeah, we will see all the universes, the various...
Dr. Ashish sir is there for the cataract verse.
No. We are going to be taking the verse.
Okay.
So we will be doing all the various universes, right? How many are there? Right, so thank you everyone for this. Let's take a selfie, let's take a photo. We have a very good audience right now, being a Sunday morning, first session of Sunday morning. Everyone, thank you for taking the time to wake up in the morning and come for this session. Let's take a selfie with the audience. Dr. Prasanna, selfie with the audience right now. Selfie with the audience. Thank you. So the metaverse is here in the center of the aisle. If you want to see the metaverse, go ahead. So Dr. Pavitra is helping somebody see the metaverse.